Let us now go to diagnosis through the tongue. The topic is shape and surface. Different shapes of the tongue and the presence of red spots on the tongue are factors associated with the health status of the Zhangfu organs. Therefore, observing the shape and the surface of the tongue is an important aspect of diagnostic tongue reading. Red spots on the tongue surface become noticeable because of the swelling of the tongue papillae caused by inflammation. They are not raised above the tongue surface under normal circumstances. If the tongue papillae are enlarged and become prickled, it indicates hyperactive endogenous heat in the body, signaling that there may be inflammation in the body. Red spot and prickles on tip of tongue indicate exuberance of heart fire. Red spots and prickles on center of the tongue indicate hyperactive gastrointestinal fire. Red spots and prickles on side of tongue indicate exuberance of heat disturbing the liver and gallbladder internally. Red spots with depression, little and very dry tongue coating signal the deterioration of a chronic disease. Cracks like gullies appear on the tongue surface. They may be horizontal, vertical, or shaped like the Chinese character, with no coating in the cracks. Such sign on the tongue mostly results from endogenous heat in the body, depleting the body of fluid, and essence and blood are so deficient that they cannot nourish the tongue. Horizontal cracks indicate yin deficiency due to old age. Dark red tongue without coating or with horizontal cracks is indicative of yin deficiency and depletion of body fluid. Cracks shaped like the Chinese character indicate excessive heat in the body. Pale light tongue with cracks indicate deficiency of essence and blood. Dark red tongue with fissures on sides and tip indicate flaring up of heart fire. The tongue body is bulkier than usual. When sticking out, it fills the whole mouth and its edge is uneven due to teeth impressions. If the body of the tongue appears pale, along with the coating, it indicates a deficiency of kidney yang, and there is water dampness, phlegm, and fluid retention. Pale, moist tongue with teeth impressions indicate exuberance and stagnation of cold dampness. Pale red tongue with teeth impressions indicates spleen deficiency. Red, swelling tongue with teeth impressions on the sides indicate turbid phlegm stagnation. Glossy tongue surface, enlarged, round, and tender tongue body with teeth impressions on the sides indicate spleen yang deficiency. When the body of the tongue is clearly thicker and bulkier than usual, and the tongue fills the whole mouth when sticking out, it suggests a deficiency and decline of spleen yang, or it may be combined with cold dampness, causing the tongue body to become enlarged, floaty, tender, and pale in color. It often has teeth impressions too. This is a sign of a deficiency syndrome, which includes a spleen or kidney deficiency. Bulky tongue body with teeth impressions on the sides, thin white coating indicate fluid retention syndrome and phlegm dampness stagnation. Pale and bulky tongue body with glossy surface indicate deficiency of spleen yang and kidney yang. Bulky and tender tongue body with teeth impressions on the sides indicate water diffusion due to kidney deficiency. Bulky tongue body with yellow greasy coating indicate damp heat and phlegm and fluid retention rising upward. Thank you so much for your attention.
Interviewing. Organ pain versus channel pain. Besides the above differentiation, another important one is that between pain due to the involvement of the internal organs with the respective channels and pain due to involvement of the channels only, there are four possible situations. Channel pain deriving from a channel pathology only. Second, organ and channel pain deriving from an organ pathology. Third, organ pain deriving from organ pathology. Fourth, channel pain only deriving from organ pathology. Most pains due to sprains, traumas, or painful obstruction syndrome, which are due to wind, cold, or dampness, involve a channel pathology only. The second possibility is that of an organ pathology causing a pain in the organ as well as in its related channel, such as a shoulder pain on the large intestine channel associated with damp heat in the large intestine causing diarrhea. Here we have channel pain, where we have channel pain, channel pathology only, or organ and channel pathology. The third possibility is that of an organ pain deriving from an organ pathology. This is, of course, a very common situation, such as abdominal pain from dampness in the intestines, chest pain from heart blood stasis, and others. So organ pathology can lead to organ pain. The fourth possibility is that of an organ pathology leading only to a pain in its related channel. For example, damp heat in the large intestine manifesting only with pain in the arm along the large intestine channel. This situation, however, is rather rare. Thus, the two most important diagnostic factors when confronted with pain are whether the pain derives from a deficiency or a fullness, or whether the pain involves the internal organs and channels or the channels only. Pain deriving from a fullness, for example, blood stasis, is easily explained. Stagnant blood obstructs the circulation of qi and blood, which causes pain. As for pain from deficiency, this is due to malnourishment of organs and channels. However, also in pain from deficiency, there is an element of stagnation because the deficient qi, yang, blood, or yin also causes a certain degree of obstruction. Of the pain from fullness, the main causes are qi stagnation, blood stasis, cold, and dampness, and in this order. Heat does not by itself usually cause pain, but it does more so when it is combined with dampness. Phlegm does not usually cause pain, but it may do so in certain cases. Thank you for your attention.
Let's now discuss TCM pain discrimination, part 2 of the pattern discrimination. Here is a table showing the pain quality and most frequent associated patterns. So let's start with the quality of pain. If it's a descending pain in the chest, costal region, and abdomen, its clinical significance is qi stagnation, and the proposed acupuncture points are Tai Chong, Yang Ling Guan, Chong Wan, and Nei Guan. If it's a descending pain in the head and eyes, it indicates hyperactive liver yang, liver fire scorching ascending, and the proposed points are Tai Yang, Hong Qi, and Yang Fu. The quality of pain is stabbing. It indicates blood stasis, and the points here are Geshu and Shangzhong. If the stabbing pain also is an indication of an excess type of an obstruction of the collaterals by pathogenic cold, and here the acupuncture points is Da Shui, and we can use Moxa. If the quality of pain is a cold pain, it indicates deficiency type. It's insufficiency of yang qi. Acupuncture point here is Shen Shu, Mingmen, and we can use Moxa. If it's burning pain, it's indicative of an excess condition and invasion of pathogenic fire to collaterals. Here we can use the Jingwell points for bloodletting. Burning pain can also be deficiency if there is an exuberant fire of yin deficiency. Here we can use Shensu, Shaohai, and Shui Guan. If the quality of pain is heavy, its clinical significance is dampness encumbering the qi dynamic. Headache with sensation of heaviness can be due to hyperactive liver yang. Here we can use Bai Hui, Ji Yang, Qi Hai, and Yang Ling Guan. If the quality of pain is sore, its indication is invasion of pathogenic dump obstructing the flow of qi and blood, and malnutrition of bones and marrow due to kidney deficiency. We can use the acupuncture point Shen Mai, Hao Shi, Shaohai, and Ningmen. Okay. If it's colic pain, its clinical significance is excess pathogenic factor obstructing the qi dynamic, a cold congelation obstructing the free flow of qi. You can use Tai Chong, Hegu, and Qi Hai. If it's hollow pain, it's insufficiency of qi, blood, essence, and marrow. You can use Pishu, Shanshu, Tai Bai, and Tai Shi. If it's headache pain, it's insufficiency of yang qi, essence, and blood, malnutrition to the channels of the internal organs. We can use Guanyuan, Mingmen, Pishu, and Shansu. If it's migrating pain in the chest, costal region, and abdomen, it's indicative of qi stagnation. We can use Tai Chong, Ji Gu, and Qi Men. If it's trespassing pain in the limbs and joints, it's wind, damp, painful obstruction. And we can use Yang Ling Guan, Ying Ting Quan. If it's a fixed pain in the chest, costal region, and abdomen, it is indicative of blood stasis. You can use Geshu, Shang Chong, San Yan Jiao. If it's fixed pain in the limbs and joints, it's damp, cold, or damp heat obstruction, heat accumulation, and blood stasis. We can use the acupuncture point in Lingguan, Lichi, Shui, Hai, and Kunlun. If it's a pulling pain, it's indicative of malnutrition to tendinous channel, obstruction to the flow of tendinous and muscular. We can use Chinshu and Shuangchong. The patterns associated with various pain types. So if it's sore or aching pain, it's deficiency, damp evil, or cold evil, mostly in the limbs and trunk, liver and kidney deficiency, invasion of wind, cold, and damp. If it's distending pain, it's an impaired qi dynamic, liver depression, qi stagnation, counterflow liver yang, wind heat contraction, phlegm and food collecting internally, liver qi assailing the stomach, stagnant food accumulation. If it's hidden or dull pain, it's deficiency, especially when relieved by pressure or rubbing yang, qi deficiency, or depletion of yin and blood that cause failure to nourish the channels. Or it could be spleen, stomach deficiency, cold, or blood deficiency, headache. If it's hollow or empty pain, it's deficiency patterns, headaches due to depletion of kidney essence, qi, and blood depletion. If it's cold pain, cold evil obstructing the network of vessels, yang qi deficiency. If it's a colic or gripping pain, it's cold evil assailing the interior, obstruction by tangible gallstones, blood stasis, or phlegm turbidity. If it's heavy pain, it indicates dampness. If it's pulling pain, means the sinews lacking nourishment, and liver patterns, wind, cold, phlegm, or blood stasis obstructing the sinews. If it's burning pain, there is repletion heat or vacuity heat. If it's migrating, it's impaired qi dynamic. And if it's, or it could be wind prevailing. If it's stabbing pain, it's blood stasis. Now we go to the most frequent patterns of pain and its related therapeutic principles. So first we have cold pathogenic factor in the surface. The therapeutic principle here would be warm the channels, disperse cold, relieve pain. The proposed point formula, we can use moxibustion on Hegu and Dashui. If it's cold evil in the interior, the therapeutic principle would be warm the middle, disperse cold, and relieve pain. And we can use the points Pishu, Zuzan Li, and we can use moxibustion. If it's deficient or vacuous cold pain, we can strengthen the upright qi, warm the interior, relieve pain. And the points Mingmen, Guanyuan, Shansu, Chaishi, and Pishu and Tai Bai. If it's heat accumulation pain, the therapeutic principle here would be to clear heat, resolve depression, relieve pain. And the points will be Chu Qi, Yang Lingguan, Jie Qi, Qin Qian. If it's qi stagnation pain, we mobilize qi, guide out obstruction, and relieve pain. You can use the points Taichung, Neiguan, Chihai, and Hugu. If it's blood stasis pain, we unblock the channels, quicken the blood, and relieve pain. In the points here with the Gongsun, Neiguan, Chihai, Gishu, and Sanyan Jiao. If it's liver qi depression pain, we soothe the liver, regulate qi, and relieve pain. You can use Taichung, Xinchan, Fuyang, Yanglingquan, and Ximen. If it's food stagnation, stomach duct pain, we scatter food accumulation, transform stagnation, and relieve pain. We use the points Neiguan, Zhongwan, Susan Li, Yangmen, Chansu. If it's wind cold pain, we eliminate wind, disperse cold, and relieve pain. We use the points Fengmen, Peishu, Kaochi, and Chianmai. If it's wind damp pain, we expel wind, disinhibit dampness, and relieve pain. We use the acupuncture points Yanglingguan, Yinlingguan, Jubin, and Chinmen. Thank you for your attention.
Differential diagnosis of diabetes mellitus, both Western and Chinese medicine. Diabetes mellitus in Western medicine is subdivided into type 1, type 2, and gestational diabetes. Type 1 or insulin-dependent or juvenile diabetes. The symptoms develop over days or weeks. The patient is normally below age 40. Hyperglycemic attack, there will be dehydration, drowsiness, frequent need to urinate, weakness, possible convulsion, and unconsciousness. Hypoglycemic attack from ingesting or administering excess insulin medication, shakiness, irritability, anxiety, nervousness, tremor, palpitations, tachycardia, sweating, feeling of warmth, pallor, coldness, clamminess, dilated pupils, and hunger. Type 2 or non-insulin dependent diabetes is insulin resistance, maturity onset linked with obesity. Patients normally over 40 at onset. There will be polydipsia, polyuria, polyphagia, fatigue, muscle wasting, itchiness around vagina or penis, thrush, blurred vision. Complications of type 2, heart disease, chest pain, swollen ankle, shortness of breath, irregular heartbeat, macular edema with blurred vision, loss of vision, periodontal disease, bleeding in mouth stimulated by brushing and or flossing, swollen red or tender gums, receding gums, loose teeth, the presence of pus between the teeth or gums, changed bite or jaw alignment, persistent bad breath. In diabetic nephropathy, this is kidney disease aggravated by hypertension. Neuropathy, numbness or pain in the hands, feet, or limbs. Gestational or pregnancy diabetes occurs in fewer than 1 in 20 women. Correlation with giving birth to large babies leads to high risk of development of type 2 diabetes later in life. Chinese differentiation of diabetes mellitus, diagnostic questioning according to organ interrelationships. So we have the Shang cycle between lung and stomach, internal-external pairing, spleen, stomach, and the Ku cycle, spleen and kidney. Wasting, tongue and pulse, the red tongue, edges and tip, thin yellow tongue for surging rapid pulse in upper wasting. For middle wasting, the tongue is red with yellow fur, slippery, large, forceful pulse. For lower wasting, there will be red tongue with scanty yellow fur or scanty fluids, fine, wiry pulse. Diagnostic questioning according to appetite, thirst, urinary symptoms. Thirst with excess drinking, frequent excessive urination. This is upper wasting. So lung, stomach, heat or fire, fluid damage, early stage diabetes. Big appetite and rapid hungering, lesser thirst and polyuria, emaciation. This is middle wasting, stomach fire. Excess thirst, frequent copious cloudy urination, nocturia, chi or indeficiency, frequent excessive, possibly turbid urination, more frequent at night, lower wasting, kidney insufficiency. Excess thirst, normal or reduced appetite, spleen, stomach, chi deficiency. thirst with profuse drinking, excessive eating, rapid hungering, damp heat, reduced polydipsia, polyphagia, polyuria, frequent, clear, sometimes profuse urination or urinary incontinence, spleen, kidney yang deficiency. Etiology, kidney essence deficiency for juvenile onset, aging, unregulated eating and drinking, the adult onset, emotions, qi stagnation and blood stasis as underlying patterns. The Zhang-Fu patterns for diabetes mellitus include lung or stomach heat, fire with fluid damage, stomach heat or fire, qi and yin deficiency, kidney yin deficiency, spleen and stomach qi deficiency, damp heat obstructing the middle burner, spleen, kidney yang deficiency. Thank you for your attention.
Irregular organs. Let's talk about the brain. The brain, the marrow, the bones, the vessels, and the uterus together are known as the irregular organs. Morphologically, they resemble the Fu organs in being hollow, but they do not directly receive the essential substances from food or drink. Functionally, they resemble the Zhang organs in storing essential qi, but they do not have the complex functions that the Zhang organs do. Irregular means these organs differ from the Zhang and Fu viscera. The brain is contained in the cranial cavity and is formed from the marrow collecting there. In Chinese medicine, the brain is the sea of marrow. Its physiological functions are as follows. First, mental activities. From very early times, Chinese medicine has believed that the mental activities are closely associated with the brain. The plain question states, the head is the house of the mental activities. The Compendium of Materia Medica states, the brain is the house of primordial mind. It is thus clear that generations of Chinese medical physicians understand the brain to be the source of mentality, consciousness, thinking, and other mental activities. If brain functions are normal, then vitality is full, consciousness clear, thinking quick and sharp, and memory good. Conversely, if brain functions are deficient, then listlessness, dizziness, tinnitus, and poor memory may result. In the theory of visceral manifestations, the physiological functions and pathological changes of the brain are all ascribed to the heart, since the heart is the chief of the Zhang organs. The emotions are further assigned separately to the 5 Zhang organs. Thus, the heart houses the mind and controls joy. The lung houses the soul and controls grief. The spleen houses intention and controls brooding. The liver houses the ethereal soul and controls rage. And the kidney houses will and controls fear. In clinical practice, many syndromes attributed to the brain are treated by methods that treat the visceral organs. The second function is the brain governs sensory perception by the body. As early as the era of the internal classic, Chinese medicine held that hearing, vision, and other sensory perceptions were closely associated with the brain. If the sea of marrow is replete, then vision, hearing, smell, and speech are all normal. If the brain is diseased, then these sensory functions are disrupted. There may then be blurred vision, impaired hearing, impaired smell, and impaired touch perception. Thank you for your attention.
Let's now talk about diagnosis according to Zhang-Fu organ patterns, urinary bladder imbalances, part 2. The dampness can be combined with cold or heat. If there is cold present, it will further block the urinary bladder's qi mechanism and burdens the kidney's yang aspect, which will hamper the transformation and transportation of fluids. Due to its contracting nature, cold can cause problems with voiding the urine as well as difficulties in emptying the urinary bladder completely. The dampness and accumulation of fluids can result in the person's having no thirst. Heat can also combine with dampness. When there is heat, it can boil the urine so that the urine is dark, concentrated, and odorous. In contrast to cold, heat has an expansive nature and creates overactivity. Heat can therefore force the urine out of the urinary bladder. There will then be a frequent urge to urinate, but because the heat has evaporated and condensed the urine, there will only be small quantities of dark urine. This will further exacerbated by the dampness, which will in itself block the urination. Besides difficult and frequent urination, heat will typically also manifest with a stinging and burning pain upon urination. The heat can also cause the vessels to burst, so there can be a visible blood in the urine. Heat can also result in fever and increased thirst. Although there is thirst, the damp aspect and the accumulation of fluids in the body can mean that there is no desire to drink. This is characteristic of damp heat conditions. Damp is yin in nature and sips downwards. Therefore, when there is dampness, there can be a heavy sinking sensation in the lower jaw. This is most characteristic when there is damp cold. The expansive nature of heat means that urinary bladder damp heat has a tendency to manifest with tension or distension in the lower jaw, especially in the area just above the pubic bone. This can be a subjective sensation or something that can be felt on palpation. Damp can be both exogenous or internally generated. Internally generated dampness is usually the result of spleen and kidney deficiency patterns or excessive consumption of food and beverages that produce dampness. Exogenous damp, like cold, can invade the body when the person has been exposed to climatic cold and dampness. Dampness can invade directly through the skin, typically when the person has worn inadequate or wet clothing, for example, a wet bathing costume. Damp and cold can also enter the body by the yin channels in the legs. Damp heat can arise in several ways. Damp cold will typically transform into damp heat. This process is accelerated if there is already heat present in the body. Damp heat can also be caused by the excessive consumption of food and beverages that directly create damp heat. For example, alcohol and fried food. Damp heat can invade the body from the exterior. This may be due to exogenous pathogenic qi invading the body by the mucous membranes, that is bacterial infection in the Western medicine terminology. Heat can also be caused by emotional imbalances. There is a connection from the heart by the small intestine channel to the urinary bladder. The urinary bladder also has a divergent channel that connects to the heart. Heart fire can therefore be transmitted to the urinary bladder, where it will combine with dampness, resulting in the urinary bladder damp heat. Emotional imbalances that affect the liver can also interfere with the urinary bladder. This is because the liver channel passes around the urethra and urinary bladder. Invasions of exogenous pathogenic qi can disrupt the functioning of the lung so that it does not send fluids down to the urinary bladder. These fluids will accumulate in the body's tissue and there will be a lack of fluids in the urinary bladder. This will result in acute edema and concurrent inhibited urination. The general symptoms and signs of urinary bladder imbalances are as follows. Urinary difficulties, that is, problems with voiding, frequent or urgent urination, incontinence, and painful urination. Cloudy, pale, or dark urine, increased or decreased volume of urine, distension, tightness, or pain in the area above the pubic bone. Thank you for your attention.
Let us now go to etiology in Chinese medicine. The topic is rheum and blood stasis. Like phlegm, rheum is generated when the climatic evils or inappropriate food and drink disrupt water metabolism, or when the passions disrupt the transforming ability of the lung, the spleen, the kidney, and the sanjiao. In general, it is a thin and clear fluid that can accumulate in various parts of the body. Rheum in the intestines may cause abdominal gurgling or rumbling. Rheum in the chest wall may cause swelling and fullness and pain on coughing. Rheum in the chest cavity may cause chest tightness, coughing, shortness of breath, inability to lie flat, and puffiness. Rheum in the superficies may cause general edema, absence of sweat, and heaviness of the limbs. Blood stasis. This is an accumulation of stagnant blood. Static blood includes blood that has left the meridians, or blood that is blocked in a meridian or an organ. As a product of an abnormal process, static blood can also cause illnesses, since it can lead to pathological changes. Now let's look at the formation of blood stasis, disease evil lodged in vessels. Both exogenously and endogenously caused illnesses can lead to the blood stasis. Among the external causes of illness, the cold evil is the most likely because of its nature to contract and gel. When the heat or fire evil lodges in the vessels, they boil and concentrate blood, or the heat evil blocks blood flow and forces the blood to extravasate. In both cases, they induce stasis of blood. Excessive emotional upheaval can cause blood to flow abnormally, in that way also fostering blood stasis. For example, depression may lead to the stagnation of liver qi, and rage can lead to abnormal ascent of blood and qi. In both cases, blood stasis may result, stabbing pain in the chest, ribs, or in the head. Disharmony of actions of visceral qi and blood. The normal circulation of blood and fluids depends upon the cooperative actions of the Zangfu viscera. Any significant disturbance of these actions can cause impedance to blood flow and lead to blood stasis. For example, if the lung loses its diffusion or the liver loses its dispersion and depuration and facilitation, then qi is impeded and blood stasis can form. When heart qi is deficient, there is not sufficient motive force for blood circulation. When spleen qi is deficient, there is no control over blood, so that blood extravasates. Trauma. Physical trauma or carrying excessive burdens can all lead to local stagnation of qi and blood or injury of the collaterals and lead to blood stasis. Different kinds of bleeding can also lead to blood stasis. For example, bleeding in the visceral organs, bleeding under the skin, and bleeding following childbirth. In addition, chronic diseases can lead to qi deficiency, loss of motive force for blood circulation, and blockage of the meridians. Under such conditions, blood stasis can gradually develop. Now let's look at the characteristics of static blood-induced conditions, variable location, and manifestations. This characteristic is due to the fact that blood stasis can develop in many different areas and it can result from many different factors. This can be illustrated by many examples. Blood stasis in the heart can produce palpitation of the heart, chest tightness, precordial pain, and cyanotic nail beds and lips. Blood stasis in the lung can produce chest pain and hemoptysis. Blood stasis in the stomach and the intestines can produce hematemesis and melena. Blood stasis in the liver can produce flank pain and abdominal mass. Blood stasis attacking the heart can induce raving behavior. Blood stasis in the uterus can produce pelvic pain, irregular menses, painful menstruation, amenorrhea, and vaginal discharge of dark purple clots or metrorrhagia. Blood stasis in an extremity of a limb can produce deep ulcers. Localized blood stasis elsewhere on a limb can produce circumscribed purple and painful swelling. Here are some common features of static blood-induced conditions. There's squamous and dry skins, blackish complexion, cyanosis, ecchymosis, pain, stabbing pain, tumor, bleeding, thread-like uneven pulse. Stasis in the lung will have expectoration and hemoptysis and pain in the chest. Stasis in the heart will have chest congestion, purple lips, and angina pectoris. Stasis in the epigastrium or abdomen will have hematemesis or blackish stool. Stasis in the uterus will have lower abdominal pain, masses, and irregular menstruation. Stasis in the extremities will have numbness and pain of extremities or atony of limbs or paralysis. The common characteristics. Though the diseases and conditions caused by blood stasis are so different, they still share some common characteristics. Pain. It is mostly stabbing, fixed in position, and more severe at night. With swelling, it is fixed in position. If due to trauma on the body surface, it is partially purple. If internal, it is mostly felt as a mass that is hard to the touch. Bleeding. The blood is mostly dark purple in color or contains clots. For lusterless skin and nails, the complexion is dark or cyanotic. The skin is dry and rough, and the lips and nail beds are cyanotic. Tongue appearance: the tongue is purple and dark and sometimes speckled with purple spots. The vessels under the tongue may be purple with varicosity. And the pulse is mostly thread-like and impeded, deep and taut or intermittent. Thank you so much for your attention.
We will continue discussing guilt, still on emotions. Guilt forms the core of Judeo-Christian psychology and theology. Guilt also formed an important cornerstone of Freud's theories. It is important to distinguish the subjective sense of guilt from its objective counterparts. For example, a person may be found guilty in a court of law without feeling guilty. In a religious context, a person may deem himself to be guilty before God, but still not feel guilty. Someone may be guilty of doing something reprehensible, but still not feel guilty. It is therefore the feeling of guilt that is all important. People who are prone to blame themselves for everything that goes wrong may also suffer an unjustified and subjective sense of guilt. Guilt is self-reproach for some actual misdeeds, or an inborn feeling of guilt totally disconnected from any misdeeds. Guilt includes a sense of inadequacy and despair, not found in shame. Guilt does not require any particular offense, and the doctrine of original sin is an example of this. When assailed by a feeling of guilt, a person is one's own judge, and often more ruthless and less reasonable than any real judge. Guilt is inwardly directed, and its object is the self. In this sense, it is almost the opposite emotion to that of anger, as this latter emotion is usually directed at another person. Guilt is based on moral criteria of having broken a law of morality. The mythology of guilt is a doctrine of the original sin. The authority providing the criteria is absolute and unquestionable. Guilt is a dark emotion with no redemption. It is a much darker emotion than shame. Guilt can have different effects in different people. First of all, it may lead to chi stagnation. It affects any organ, and especially the lungs, heart, liver, and kidneys. Because of its dark, stagnating character, the chi stagnation may cause blood stasis easily and quickly. This blood stasis may be in any part of the body and any organ, but particularly in the lungs, heart, spleen, and liver. Here we see the clinical picture of guilt. So the patient has a purple tongue with red tip, blood stasis, there is sinking of chi, urinary or gynecological problems, pulse is deep and weak and firm. Under certain conditions, guilt may also cause sinking of chi and affects the kidneys, causing some urinary problems or menstrual problems from sinking of chi. The tongue has a red tip and possibly purple body. The pulse is deep, weak on the kidney positions, possibly slightly overflowing on the heart position, and choppy without wave. It may also be firm. When guilt results from repressed anger, the pulse will be wiry. So here we see the effect of guilt in the following flowchart. So guilt can either cause chi stagnation or chi sinking. Chi stagnation, particularly of the lungs, heart, liver, kidneys, and chi stagnation of the heart and liver can lead to blood stasis, while chi sinking resulting from guilt can impact the kidneys. To summarize, guilt is a pervasive emotion in Western patients, and it is completely missing from Chinese medicine books. What concerns us in dealing with emotions is not guilt, but the feeling of guilt, which is totally unrelated to an actual crime or transgression. Guilt forms the core of Judeo-Christian psychology and theology. Guilt also formed an important cornerstone of Freud's theories. Guilt is self-reproach for some actual misdeeds or an inborn feeling of guilt totally disconnected from any misdeeds. Guilt may lead to chi stagnation. It affects any organ, especially the lungs, heart, liver, and kidneys. Because of its dark, stagnating character, the chi stagnation may cause blood stasis, particularly in the lungs, heart, spleen, and liver, easily and quickly. And guilt may also cause sinking of chi and affect the kidneys, causing urinary problems or menstrual problems from sinking of qi. Thank you for your attention.